Serious therapists, what is something people are afraid to tell you because they think it's weird, but that you've actually heard a lot of times before? I have heard some variant of this is probably weird, but I feel if I am my true self around others then they won't like me more times than I can count. As I explore the formative situations to this belief alongside my clients, it definitely pulls at my heartstrings. I'd say a common one is believing that there's something innately, irreparably wrong with them that makes them unable to ever truly fit in. For a lot of people it's such a deeply ingrained belief that it can be extremely painful to acknowledge or express, regardless of the level of personal success in their lives. The worst is knowing beyond doubt that you are holding a false belief about yourself and yet not being able to change it. I've spent long enough in therapy trying to figure out what's wrong with me to know there's no there, but the ingrained pattern of thinking doesn't go away. The amount of people I see who feel like they should be grieving a certain way and are afraid that they must not have loved someone, or must not have cared. People grieve in all sorts of ways. The 5 stages of grief are bulls. I was consulting with another clinician who was seeing a couple whose daughter had died. The wife was convinced that the husband must not have cared about her because he wasn't grieving out loud. In reality, while she had been going to support groups and outwardly expressing, he had been continuing to work in a garden that him and his daughter had kept when she was alive, using that time to process and grieve as he did. Both were perfectly fine ways of grieving. However, it is expected that one's grief is more than the other. They both ended up working it out, however, he driving her and others to their weekly support group, her attempting to work in the garden with him on the condition that they didn't talk. Really sweet. To that same extent, the amount of people who are unaware of their own emotions and emotional process is astounding. So many people feel only angry or happy and worry something must be wrong with them otherwise. Normalizing feeling the whole gamut is just as important. Recognizing what we're feeling as well as what it feels like in our body when we're feeling is incredibly helpful for understanding how we process and feel. As a whole, how we treat emotions as a society is kinda fricked. Thanks for coming to my TED Talk. 2 topics come up with regularity: when someone discloses to me that they were sexually abused as a kid, and/or when someone is experiencing suicidal ideation. Both are something I hear from clients every single day, and so I don't find it weird at all. But when I have someone in front of me who's talking about it for the first time, I know it's important to validate the fact that even though I might be talking about this for like the 5th time that day, they have never talked about this ever, and are in need of gentle care to feel safe. Yes, that validation was life-changing for me. I talked about my early childhood sexual trauma to a few people and counselors to try to process, and was often told that what I went through wasn't that bad or someone else had it worse. It wasn't until a few years ago that our marriage counselor validated my feelings in front of my husband that I truly felt heard and was able to start healing. That they do not know what they enjoy doing. Often they have people in their life, including therapists, say try to do something fun today or ask what do you like to do when you have free time. Many people I work with do not know what those are. Once I explain that I dislike these statements questions because they assume people should know the answer, and that many people don't, I can watch as they relax, take a deep breath, and say something to the effect of, "Oh my, that's so good to hear. I have no idea what I like to do." That's part of the problem. More often than not they feel like they should know and that everyone else their age has it figured out. They are embarrassed to say that they don't know when in fact not knowing is very common. I couldn't even try to count how many clients I've had this conversation with. That makes me feel better actually. I've lost all interests besides one music artist. Intrusive thoughts. Nearly everyone has thoughts about pushing the old lady onto the subway train, swerving into opposing traffic, or stabbing their loved one in the stomach while cooking dinner with them. Some folks, however, take these thoughts very serious that believe that they might act them out. It's called thought-action fusion. Most of us are able to brush them off, though. A common one in the time I was a therapist was simply "I don't know." You'd be surprised how reluctant people are to admit that they don't know why they're feeling how they are. But that's exactly why you all were. "I'm not a therapist anymore" sat there with me, so we can figure out why together. It always put me in mind of a line from America by Simon and Garfunkel. "Kathy, I'm lost," I said, though I knew she was sleeping. I'm empty and aching and I don't know why. That Simon and Garfunkel line is one of my favorites ever. It's so full of emotion. It's beautiful and sad. Unwanted intrusive thoughts are normal and do not mean you are a bad person. Yes, even intrusions of sexual, religious, moral themes. By definition, these are thoughts that are unwanted. BC they go against your own values and highlight what you don't want to do. A religious person having unwanted blasphemous images pop into their mind. Or a new parent having unwanted sexual thoughts about their new baby. However normal these thoughts are, over 90% of the population, the moral nature of these thoughts mean that often people experience a lot of shame and take many years before they first tell someone about them. Psychologist here. Basically, anything having to do with sex. There's so much shame. Sexual abuse, sexual fantasies and fetishes, erectile dysfunction, infidelity, becoming sexually assertive. I've been told that I have a good psychologist's face. I try not to have a strong reaction to normalize the discussion. With adolescents, they are extremely anxious to tell me if they've relapsed or aren't doing well. They cut one night or they were suicidal. They're having a lot of negative self-talk or panic attacks. They'll come in, pretending everything is okay. It's usually in the last 10-15 minutes that they'll say something. They'll reveal that they worried they'd let me down, that I'd be disappointed in them. It usually turns into a discussion about policing other people's feelings and tolerating emotions. I explain that I care about their well-being and it's my job to monitor my emotions and reactions, not their role. Those last 15 minutes of a session are when I spew out all the best stuff to my therapist, and then I feel a negative emotion that I brought it up at the end and can't finish talking about it. Clients become quite fearful of admitting that they weren't successful since the last time they had a session. This could include not succeeding in using a coping skill that they're learning about, or not being able to complete a homework assignment I gave them. Humans aren't robots, and therapy is a lot of work. That being said, I don't expect people to be perfect as they start to work on themselves in a positive way. It takes time to really commit to change, especially in relation to trauma or conflicted views that an individual holds. I feel as if the client doesn't want to let me down as their therapist, but these failure events are just as important to talk about as successful moments. That they don't like their family members, are angry, want to stop communication with their parents, etc. I work in a country which is more culturally collectivist, so not wanting anything to do with your parents makes you an butthole in the current cultural sense. We deal with this almost on a daily basis. There is deep and profound shame in this, and when we find that line of it might be that your parents are toxic to your mental well-being, trigger your trauma. Many of my clients actually get visibly angry with me. Cultural psychology is so important, cause when I first moved here I had my American European hat on. Oh boy, did I need to adjust. Definitely, I was in therapy for pretty much all my childhood due to abuse from my dad, and I blamed and hated my mom for it. Even then, as a really young child, I knew it wasn't her fault, but I still hated her for everything that happened. I didn't admit that fact till very recently, but that resentment has already torn our relationship apart. Women often feel really ashamed when they tell me they are burnt out on being a parent or that they never want to have kids. I wish all of them knew how common this thought is. My best friend is a mid-30s woman with 3 young boys, one with nonverbal autism and one extraordinarily gifted. During the pandemic, she loves her boys and so do I, but she wants to take a real long break from them, and I don't blame her. Her job as a mother during all this sounds immensely challenging. Some of the most common ones have been visual and or auditory hallucinations and suicidal thoughts. I usually hear "I don't want to be put in the hospital" or "I don't want you to think I'm crazy." Also, basically anything sexual. "I'm not going to judge you for being into BDSM, fetishes, etc." Honestly, I've probably heard it before and I'm not here to judge you. Same goes with any non-consensual experiences, especially if they're working through trauma. Usually it's sex related. Shame about their desires or kinks is common. Gender questioning is another. Some people are ashamed of things they did in childhood or adolescence, haven't ever told anyone and think the team will be horrified. We have heard everything. I'm always compassionate and always understand why we do the things we do. I've yet to have anyone bring something I can't get. Hidden sexual dreams and fantasies about family members. More common than people think, and often stays that way and doesn't really interfere in the person's close relationships unless they allow it. Many things we dream or think are unconscious and involuntary, and the root of such things is often nonsensical. Many things we dream or think are unconscious and involuntary, and the root of such things is often nonsensical. This thread in its entirety had been very heartening, and this sentence in particular is immediately helpful and relevant to my experience. Thank you for expressing it so succinctly. Psychologist in the US. To name a few. Compulsive masturbation. Fears of being a pedophile rapist. This is a common OCD fear. Hoarding. Sexual performance difficulties. History of sexual abuse or sexual assault. Unfortunately, it is very common. Drug use. Amount of money spent on various things. Having an ASD diagnosis, going back to an abusive relationship, staying in an abusive relationship, grieving years and years after a loss, self-harm of all sorts, wanting to abandon their current lifestyle, for example, to have more sex, to escape responsibility or expectations, history of gang violence, crime, their sexuality or asexuality, gender identity, the impact of racism, racial trauma, paranoia, hallucinations, feeling uncomfortable in therapy, not believing in therapy, difficulty trusting a therapist, fear of psychiatric medication, fear of doctors in general. I was surprised to see suicidal ideation on others' responses. Most of my clients seem to talk very openly about suicidal thoughts and urges from the start of therapy, which I think is super healthy. I think that most of the people I've worked with had SI, current or history, as weird as it may seem. I can't imagine what a life without any thoughts about suicide would even look like. At this point, I don't recall a time a patient said something in therapy and I was shocked or even thought, oh, that's new. And if you surprise your therapist, that is okay. I wonder if we asked Reddit, what are you afraid to tell anyone, even a therapist, because you think it is weird, how many people would see that they aren't that weird at all. I was seeing my therapist, who I think is great and was super comfortable with, for depression and anxiety, and I still never told her about my suicidal thoughts because in my mind that would totally change things and it'd get serious. I do a lot of trauma work. Many people who have experienced molestation or sexual assault feel ashamed and confused because their bodies responded. Having an erection, lubrication or even an orgasm does not mean you wanted the sexual contact and it is still assault. Clients often hold a lot of shame and confusion about this. They wonder if it means they wanted it or if there is something wrong with them. It is a tough thing to work through because of this. Assault is assault. Sometimes human bodies respond to sexual touch even when we don't want the touch. Someone once said it's like tickling. You laugh when you get tickled even though you don't want someone to tickle you. Being tired of being a mother. There's this social thing of loving your kids and they should be the first thing in your life, but having a child is messy and a real hard work. It's normal to just want to take a break once in a while from all that responsibility. As someone in the substance abuse field, I know that it's difficult for clients to tell me they got high with a parent, but it's something I get told fairly regularly. It's kinda sad. I've had patients tell me their parents used to give them drugs as kids to basically sedate them. It's soul crushing. That they haven't had sex with their partner in years and don't know how if they will ever have sex with their partner again. There is so much shame around sex in the USA that a lot of people are scared to talk to their partner about their sexual needs. Time goes by, and suddenly they haven't had sex in 3, 5, 10 years. It starts for a lot of people in their 40s and 50s. A lot of people, falsely, believe there is something wrong with their marriage because they fantasize about people other than their partner. My wife and I have been married 7 years and I swear she turned asexual the past year. She gets upset if I put my arm around her at night because it interrupts her 45 minutes of scrolling through Instagram before she falls asleep. She accidentally put her arm on top of me one night and I still think about it sometimes because I miss being touched so much. Recurring intrusive thoughts about harming others can be hurting, killing someone, or sexual fantasies about children or relatives. Usually people take a while to admit those. The reality is that if you are having them frequently, you aren't dangerous. You probably have OCD and are terrified that you might be dangerous. It was once explained to me that intrusive thoughts are often not things we're wanting to do, but our brain basically wants to bring it up and contemplate about something bad that could happen, so it's ready to respond. That they hear voices. I've found that a lot of people aren't familiar with their own internal dialogue or self-talk, and that this is typically normal internal processing. A lot of people think that they are hearing voices and hallucinating. There are some pretty simple questions we can ask to determine if it's hallucinating or just internal dialogue, and most often it's the latter. I work in an older adult service for people with dementia and mental health problems. I see a lot of family members, carers feeling ashamed of the fact that they are finding it incredibly difficult to care for someone that has dementia or a chronic mental health problem. Carer burnout is a real issue, and people need to know that it's not easy to see someone you love struggling every day, or slowly fading away month by month. Carers and family members desperately need time for themselves and need to know that it's okay to feel the way that they do. No one is superhuman and we all have our own needs. It's why we have therapy groups for carers. It's okay to struggle to look after someone, and you should in no way feel ashamed of having those feelings. I'm support worker, social worker, not a therapist. I've had clients too scared to tell me their accomplishments because they think they should only be bringing their problems to case management, and that if we see them getting better that we won't prioritize them as much. Another is hard drugs. We don't endorse it by any means, but we have to know if we need to keep an eye out for inappropriate behavior and overdoses. We never get mad at them for being high. We just wanna send them to their room to sober up. Freaking everything. Dude. Everything. You name it. I've heard it. You regret having your child and wish you never became a mom. Okay. You love your spouse but their cancer came back again and you don't know how you can go through this fight again. Yeah, I get that. Hard drugs crap. It's been a hard year. You wanna quit your well-paying job to sell carved soap figurines? Okay, well let's talk through what that might look like. You like to collect teddy bears because they give you a special little tingle in your nether regions? I don't kink shame. Seriously, we've heard everything. Everything. Unless it's someone newish to the field, less than 5 years maybe, it's generally not going to shock us. And whatever it is, even if it does seem a bit of a unique circumstance, we'll get the underlying feeling under it. In the end, everyone wants the same overall things: to feel heard, to be loved, to take care of their loved ones, to manage stress, etc. Humans do the best they can, and therapists are there to help, but we can't provide guidance if you don't give us a chance, and that means opening up. I know it's scary and some therapists do suck. It's a lot like dating. If you don't click with the first one, move on until you find one you do click with. A lot, and I mean a lot, of people who experienced sexual abuse feel very guilty for a myriad of reasons that are not their fault. 1. Guilty for attracting the attention. 2. Guilty for not speaking up. 3. Guilty for enjoying being seen by someone. 4. Guilty for having any sort of pleasure from their abuse. All those feelings are common and addressed in therapy, but it is so hard for people to discuss it. Intrusive thoughts about sex with family members, or, in their mind, nymphomania as a result of childhood sexual trauma, and adult hypersexuality isn't often discussed as one of the PTSD symptoms, so people walk around with so much shame about it. I never thought of this particular behavior thought problem as related to my PTSD. Something to chew on. Thanks. Many of my clients lived through severe childhood trauma and neglect. They had no one to model or explain healthy emotions or to show them appropriate ways to react to stress, fear, anger, etc. Most often they'll describe a completely normal reaction to a stressor and then follow that up with "I don't know if that's normal." These are adults who were exposed to so much dysfunction during their formative years that they don't know whether it's normal to cry when they're anxious or afraid, feel angry when their boundaries have been violated, etc. When I was in private practice, I specialized in borderline personality disorder. I did DBT, which is the evidence-based treatment for it, but there is so much shame and stigma around having BPD. I have seen providers hesitate to diagnose it. My favorite sessions were the ones where I would talk about why and how people get BPD and seeing the relief on people's faces when a therapist can see that this is also something happening to them and that there is a type of therapy specifically designed to help. Those were my favorite sessions. And, to answer the question correctly, BPD. BPD is much more common than people think. Should we all confess our sins to one another? We would all laugh at one another for our lack of originality. Khalil Gibran, Sand and Foam. Hello. Therapist here. There are several. 1. Speaking to their departed loved ones. Thankfully, theories now support this and don't consider it to be a sign they are not moving on with their lives. I encourage my clients to explore the continuation of their relationships with the deceased. 2. Small ways they've made progress in the week. I know this isn't technically weird, but my clients sometimes don't want to tell me this, either because they fear I'd turn round and say they don't need therapy anymore, or because I might find the progress unnoteworthy, both of which are totally untrue. 3. That they're having bizarre intrusive thoughts of hurting themselves, others, sexual fantasies and so on. As a therapist, I'm trained to appreciate the whole world that lies between thoughts and action, and all it really proves is that we have an imagination. It's highly unlikely I'll need to break confidentiality, and won't call the police immediately. 4. Sex-related things in general. Eventually we'll talk about sex, and I'll see a weight lifted off their shoulders for how unfazed I am by their apparently weird sex life. Honestly, it's rarely that weird, and we all have kinks. Life is fruitful, there's no need to be ashamed. I didn't like telling my therapist about small accomplishments over the week because I was ashamed at being in a place where I was proud to have brushed my teeth 3 times in 7 days. Everything. Did clinical work for about 5 years and heard just about everything 10 times over. But seriously, people are often reluctant to talk about their darker urges and feelings. Therapy is likely the only chance where you'll get to have that conversation openly and honestly. Therapists know everyone has this side to them, and working on it is both difficult and admirable. I used to work in a religiously conservative area of the country a few years back. It's routine to ask about sexuality during intake. The number of patients admitting to suffer from sex addiction was quite high. On further questioning, this usually meant masturbating once a week. Other ones I could name are intrusive thoughts, like suddenly thinking about turning the wheel into oncoming traffic, and fear of being crazy after experiencing a panic attack, or a mistaken belief. Psychological disorders are rare and must mean something is horribly wrong with someone's character. Sexual side effects of medication. Losing your sex drive is a common effect of SSRIs, and when I meet with patients after they've been prescribed, I'll ask about whether they've noticed a difference. Often, they have but are worried about telling their prescriber. I will advocate for them to do so, and it is usually a positive experience for them. I'm usually more afraid that I'm boring them. Oh, you have anxiety about your normal job and normal family, and we've been talking about it for a year now? Let's party L. Finishing up my doctorate in clinical psychology and primarily work doing forensic assessments, anything from insanity competency evaluations to abused children who should be excused from testifying. There's a lot of people who have experienced sexual abuse and are ashamed to talk about it, particularly in regard to how it affects their current sexual functioning. Also, self-harm is a big one people tend not to want to discuss as well, but is incredibly common in this line of work. Honestly, after a client in my first year of practicum work told me he was collecting roadkill and fantasized at length about murdering specific people in his life, I was fairly desensitized. Still get the shivers thinking about that client. He was so profoundly creepy in a very genuine way that I'm not sure I can accurately describe on Reddit. Really ripped the band-aid off with that one. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.